Well, for some people, conventional exercise and diet are not enough to help them lose weight, so they may have to turn to surgery.
That's right. However, to maintain that healthy weight loss, surgery needs to be paired with a healthy lifestyle and good behavior, even post-op. Joining us this morning to tell us all about how you can do this is Jennifer Sweet from Anytime Fitness, as well as registered nurse and bariatric program coordinator Danielle O'Brien at St. Joseph's Health. Good morning.
Good morning.
Thanks so much for joining us. You know, we were talking a little bit off camera, Danielle, because we asked you how common is bariatric surgery, and we're learning very common.
Very common. At St. Joseph's Hospital Health, we do about 600 cases a year with our bariatric surgeon, Dr. William Graber's group, anywhere from 15 to 20 a week, so very common.
And just for those who maybe don't know what bariatric surgery is, what is it, just really quickly?
It's a weight loss surgery where they actually cut the stomach to make your stomach smaller, or the sleeve. We do two procedures at the hospital, so the gastric bypass or the sleeve, and it's to help reduce how much you're taking in, but really the main goal is to change your behaviors long term for success.
Okay, yeah, so that's the key, is to change the behavior. We're not trying to help you lose weight, and so it's just to change your behaviors, which will eventually help you lose the weight.
Absolutely.
Now, how does that connect with you, Jennifer? Because I'm like, well, if we're changing the behavior, then that means we don't need to go work out. I mean, what are you doing here, girl?
So actually, I had a client who came to me after she was cleared after her bariatric surgery, and she knew through going through the program was really great at St. Joe's, she knew that she had to continue to change her behavior after the surgery because it was easy to fall back into old habits. And she also knew that, you know, with the weight loss came a lot of need for toning because of the loose skin and stuff like that that came along with that. So she came to me and I worked with her for a while, and then she was the one who connected Danielle and I and said, you know, I think there are other, you know, patients who can benefit from your help.
Now, speaking of the skin, because I feel like, you know, you watch some of these shows on TV and you see that could be a big issue. Can you tone the skin? Can you, through weights and working out, tone the skin so that you don't have so much loose skin?
It does depend on the patient and how much weight they actually lose.
Okay.
But we can overall just make sure that strength and kind of just general, I guess that's the best way to put it, is just kind of strength and health and like energy levels come back through exercise.
Okay, yeah.
Now, you know, Danielle, we've talked a lot with Jennifer about her weight loss struggles. You also have a history with weight loss and whatnot, right?
Not personally. I've been fortunate, but just through being a nurse. I've been at St. Joe's for a while. I've seen it. I've been in this role for 6 years, so just seeing it through my patients. It's a lifestyle change, as I mentioned. The surgery is a tool. It's a tool to help them. I can tell you countless number of patients that come through our practice have lost weight on their own with diet and exercise, but couldn't maintain it, whether it was genetics or whatever reason, they gain that weight back again. So this is a tool to help kind of reset things and keep them on the straight and narrow, hopefully for the long term.
How do you sort of prepare somebody and set them up so, you know, because I feel like going into a surgery like this must be somewhat of a relief for people, but then how to get them thinking, like, guess what, you still have a lot of work to do, right? Because that's the reality.
It is. It's a tool. So you still have to eat right. You still have to exercise, and this is how Jennifer and I came together. I do a support group, so we do offer them support groups monthly. The office is wonderful. The patients can stay connected to them forever if they need to, if they're getting off track, to kind of get back on track. So important, and I've always introduced fitness and different ways of getting activity after surgery to the patients, and this is how Jennifer and I connected. So yeah, they have to change their lifestyle habits for long term. Positive thing, I think, is as they lose the weight that first year, they feel good. They realize how good they feel. I have a woman who said, I think she's 65, never went to the gym her entire life. She's at the gym 5 days a week.
Wow.
The more you feel good, the better you will, and the more you want to do that. And so hopefully that's how they continue to change those habits in the long term.
And in the beginning, before you even can go to surgery, you kind of have to be you have to be healthy. So you should really start working out, right, Jennifer, before you even get the surgery.
Absolutely. I mean, in general, if you're healthier as you go into surgery, you'll probably have an easier recovery.
Yeah, that's what they say.
And they do give them a modified, you know, type, even if it's walking 5 minutes a day, that's great. That's a great start. So whatever you can do.
Well, and that's where you all come in too, because there is the fitness component at Anytime Fitness, but there's also the nutrition component and then the support, right?
Exactly.
Right.
Exactly. The coaching is the biggest thing that we do. So providing everything that our members need, regardless of, we've talked about it in the past, regardless of their background. So whether they're coming in, you know, pre-bariatric surgery, post-bariatric surgery, whatever the situation is, the trainers are there to give them the guidance and the support they need, from just the general advice and the coaching to all the way, like you said, the nutrition if needed.
Now, speaking of your coaching and nutrition, how's that Cicero location coming?
It's coming. It's so exciting to just see that we're going to be on both sides of the town, and you know, we'll be able to branch out straight through, straight through the area.
Do you have an opening day yet, or no?
We don't have
putting
a
you on
day.
the spot.
We don't have a day, but I can tell you it's going to be open in time for those New Year's resolutions.
Oh, good. Okay. All right. Okay.
course,
Okay. There we go.
yeah,
There we go.
that's
In Cicero.
perfect.
In
Yes.
Cicero is what we're talking about. Their new location coming up in Cicero. Well, listen, Anytime Fitness is located at 315 Fayette Street in Manlius. For more information, you can give them a call, 315-791-0026, or visit anytimefitness.com. And you can also connect with them on Facebook right there, Anytime Fitness Manlius.